Mask requirements are dropping for public events, but is it safe for everyone to return to a more normal lifestyle? Joining us now to talk about all of this is Dr. Bill Hartman, principal investigator for the UW Health Pediatric Moderna vaccine trial. We appreciate you being with us once again today, Dr. Hartman. You know, we are seemingly in a pretty good stretch when it comes to COVID. We're talking low case numbers, low number of hospitalizations, but COVID-19 is still pretty dangerous for the millions of immunocompromised patients nationwide. But of course, so are so many other illnesses. So what should the standard protocol be for them and maybe those around them or caretakers for them?
Well, of the 7 million or so immunocompromised people throughout the United States, they really need to have an in-depth conversation with their providers so that they can get the most up-to-date information concerning their illness and what they can do to prevent it. There are some treatment options out there, including the long-acting monoclonal antibody from AstraZeneca is available. We continue to monitor their immune status after they've been vaccinated. We're trying everything we can to incorporate them into this new post-pandemic world to make sure that they feel as safe as possible as they go about their lives.
You know, you brought up the vaccination point. There's been a lot of talk about the fourth COVID shot that's potentially needed from Pfizer. Do people who have had 3 shots, do they need this 4th shot? And when it comes to natural immunity, if you've actually had COVID, how significant is this 4th shot and how necessary?
Well, and I don't think that we have all the data on that yet. Right now, the data that we do have is a little bit murky as to whether or not we really need this 4th shot. What we do know is that after the primary vaccination series plus the first booster, people are very, very well protected against severe disease and hospitalization and death from COVID-19. What they're less protected against at this point is the Omicron variant and the variants of Omicron, because it can evade immunity to a certain extent. And so what we have to do is kind of perhaps redefine what being immunized is, what being vaccinated is, and whether or not being protected against hospitalization, severe disease, and death is adequate. And if so, really, a person who's had COVID or a person who's been vaccinated and boosted should have appropriate immunity.
And at this point, there isn't an Omicron-specific vaccine, correct?
Only in clinical trials.
In clinical
trials.
So
they are looking at Omicron-specific vaccines, and we should have data on that probably by midsummer.
And lastly, really quickly before we let you go, so if somebody has had, say, their 3 shots, they've had the vaccine series plus the booster, but then they ended up getting a likely Omicron breakthrough case, say, middle of January, how is their natural immunity when it comes to that? You know, is this something where they're likely going to need another shot within a year's time, within a few months' time? You know, how does the natural immunity play into all of it?
Well, I think that the natural immunity goes beyond just the measured antibody levels. The B cells and the T cells that are embedded in your body and have the remembrance of what that virus looks like, so it can attack things relatively quickly within a couple of days of being exposed to the virus, that's always going to be there. And so the natural immunity that you've built up either from being infected or being vaccinated really should give you very, very long-lasting protection.
That is good news to hear. And the numbers seem to be in agreement with that. So we hope things continue in the direction that they're heading right now. Dr. Bill Hartman, we appreciate you being with us.
Thank you. Happy St. Patrick's Day.
You too.